Imagine you are overseeing, like, this massive construction site, and you've just poured the vast concrete foundation for a brand new skyscraper.
Right, the base of the whole thing.
Exactly. It's wet, it's vulnerable, and it is actively curing. If you ignore that curing process and, I don't know, immediately start framing the walls and dropping heavy steel girders onto that foundation before it has properly set, the concrete will inevitably crack under the load.
Yeah, you basically ruin the base of the entire structure right there.
You do, because the structural integrity of the completed building completely depends on respecting that initial quiet period of chemical curing.
If you rush the foundation, the building is never truly stable. It just isn't.
Welcome to the deep dive. Today, we're exploring a question that creates, honestly, an immense amount of anxiety and confusion for so many people. And that is, how soon can you safely return to gym workouts and high-impact exercise after pregnancy or major abdominal and gynecological surgery?
It's a huge topic.
It is. And for you, the learner listening right now, we know how incredibly frustrating this topic can be. Because if you are an active person, sitting still when you finally feel physically capable of moving again, it can feel like a loss of identity.
Oh, absolutely. There's this frantic societal pressure to, bounce back to your old gym routine. You don't want to lose your fitness progress.
Right, the whole bounce back culture.
Yeah, and that psychological friction is very real. You are fighting against an entire fitness industry that praises these rapid returns to heavy lifting and running. But biology does not care about your calendar.
It really doesn't.
And certainly does not care about social media trends.
Huh.
The tissues in your body require a highly specific physiological environment to rebuild.
So, to give you the actual roadmap for that rebuilding process, we are synthesizing a massive stack of medical guidelines today.
A really comprehensive stack, yeah.
We're talking NHS trust protocols, the Pelvic Obstetric and Gynecological Physiotherapy Network, the HSE, Mayo Clinic advisories, and the latest peer-reviewed sports medicine papers all the way up to 2026.
All the heavy hitters.
Exactly. The mission of this deep dive is to cut through that societal pressure and equip you with the actual science of how to rebuild your strength safely, effectively, and without triggering long-term setbacks.
And I think it's important to note that we're going to focus not just on the specific timelines, but why our tissues actually require this specific pacing.
Okay, let's unpack this. We have to start by dismantling the biggest myth in postnatal and post-surgical fitness, which is the 6-week all-clear.
Oh, the famous 6-week checkup.
Right.
It has unfortunately been treated as this, magical finish line.
Like you're instantly healed.
Right. A doctor checks your incisions, asks how your mood is, and suddenly people interpret that as a green light to jump straight back onto the treadmill or head into a heavy CrossFit class.
But that's not what that checkup means, is it?
Not at all. If we actually look at the science of wound healing and tissue repair, that 6-week timeline is wildly inaccurate for any kind of high-impact activity.
The cellular biology of this completely upends how we usually think about recovery. The medical papers describe tissue repair as following a synoidal trajectory. Let's break that down for the listener, because understanding that curve explains everything about why early resting is mandatory.
Yeah, so a synoidal trajectory basically means the healing process isn't a straight line going upward.
Like a wave.
Exactly like a wave. Imagine a wave on a graph that dips down before it finally rises. In week 1, immediately after major abdominal surgery or birth, the tensile strength of your tissue is almost zero.
And tensile strength meaning its physical ability to withstand being stretched or pulled apart.
Right, it's practically zero. The tissue is entirely reliant on external stitches if you have them, or just the very initial fragile blood clotting and temporary cellular scaffolding your body is frantically laying down.
So in our construction analogy, that is the literal wet concrete. It has zero load-bearing capacity.
None whatsoever.
But what I found fascinating in the surgical data is that the highest rate of wound dehiscence, which is the medical term for a wound physically reopening or tearing apart, that doesn't happen in week 1. It happens in the 2nd week.
And this is where that synoidal dip occurs. By week 2, the acute, sharp pain of surgery or childbirth has usually subsided, right?
Yeah, you start feeling a bit more normal.
Exactly. The inflammation and swelling are going down. You naturally feel better. But at a cellular level, your body is actively breaking down the weak, temporary collagen it laid down in week 1 so that it can replace it with a stronger, more permanent type of collagen.
Oh, wow. So it's actively swapping the materials out.
Yes. And during this active swapping phase, the physical structure of the tissue actually weakens. The scaffolding is being removed while the building is still trying to stand.
Wait, if the tissue is weakest in week 2, why are people so eager to start doing housework and light workouts exactly when they should be resting most?
Because they feel the pain decreasing. So they decide it's safe to start vacuuming the house, carrying heavy laundry baskets, or doing light home workouts.
I mean, you are applying load precisely when your tissues are at their absolute most vulnerable to reopening. It's like putting the roof on our skyscraper at week 2. The foundation is at its softest point. The whole structure just sinks.
It is a really dangerous illusion.
Yeah.
And even if we jump much further ahead on that healing graph to 12 weeks of 3 full months post-surgery or postpartum, the repaired tissue only reaches about 80% of its original strength.
80% after 3 months.
Yeah, it actually takes up to 2 full years for the abdominal fascia to fully regain its pre-surgical density. Then, if you factor in pregnancy, you have an entirely separate hormonal landscape to contend with.
Right, relaxin.
Yes, the hormone relaxin, which your body produces to increase the laxity of your ligaments to allow the pelvis to open for birth, that doesn't just vanish the moment the baby is born.
The sports medicine sources are very clear on this. Relaxin continues to act on the collagen in your ligaments for up to 5 months post-birth.
5 months.
So your pelvis, your knees, your ankles, they are all hypermobile. If you try to lift heavy weights, your ligaments aren't providing their normal stability.
Which means your muscles and joints are highly vulnerable to acute injury.
Yeah.
What's fascinating here is the massive disconnect in how we treat postnatal recovery versus how we treat sports injuries, even though they require the exact same biological rehabilitation mindset.
It's so true.
If a professional athlete tears a hamstring or undergoes knee surgery, no physical therapist on earth would tell them to just rest on the couch for 6 weeks and then immediately go sprint a 100-meter dash.
Right. They would meticulously rehab that athlete, focusing on, like, incremental loading.
Exactly.
So looking at these protocols, what is the actual takeaway for you listening during those first 4 to 6 weeks? Your absolute lifting limit is the weight of your baby.
And if you haven't had a baby and you're recovering from gynecological surgery, your limit is a half-filled kettle.
A half-filled kettle. We are talking roughly 2.5 kilograms or 5 pounds. That is the maximum safe load.
That's it. Exercise in this acute phase is strictly limited to deep breathing, gentle walking, and isolated pelvic floor contractions.
And that deep breathing requirement isn't just about relaxation or mindfulness, is it? It is a highly mechanical process.
It is. When you practice deep diaphragmatic breathing, your diaphragm pushes down on your internal organs, which gently presses down on your pelvic floor. And when you exhale, it all draws back up.
So it's moving things internally.
Yes, it acts as an internal rhythmic massage for the tissues. It brings vital blood flow and oxygen to the healing area, and it starts teaching your nervous system how to coordinate the core muscles again without adding any dangerous intra-abdominal pressure.
Since the outer scaffolding is so fragile in those first 6 weeks, that completely changes what we are allowed to do in terms of rebuilding strength. Let's talk about the core. Because I was reading through the Mayo Clinic notes, and they explicitly prohibit sit-ups, crunches, traditional planks, and double leg lifts for at least the first 12 weeks.
12 weeks, minimum.
And they tie this restriction directly to managing that intra-abdominal pressure.
Think of your abdominal cavity like a water balloon. During pregnancy, the 2 sides of your rectus abdominis, your visible six-pack muscles, they stretch and separate to make room for the growing uterus.
And the connective tissue running down the middle, called the linea alba, gets stretched incredibly thin.
Right. This separation is called diastasis recti.
So if you try to do a crunch or a plank before that midline tissue has regained its tension, you compress the water balloon from the top and the bottom.
Exactly that mechanism. The internal pressure has to go somewhere, so it forcefully pushes outward against the weakest point, which is that vulnerable, thinned-out linea alba at the front of your stomach.
Or it pushes downward against the healing pelvic floor.
Right. Doing a crunch severely worsens the muscle separation. You are actively stretching the connective tissue further apart instead of allowing it to knit back together.
Let's ground this in a scenario that happens all the time. You are 3 or 4 weeks postpartum or post-surgery. You're sitting on the couch, and you start scrolling social media.
Oh, this happens constantly.
Right. You see a fitness influencer doing planks or heavy kettlebell swings just weeks after birth, using hashtags about their quick recovery.
And it makes you feel like you're falling behind.
Exactly. For a listener who wants to know if their own everyday movements are causing this dangerous internal pressure, the guidelines point to a very specific visual cue called doming, or coning.
Doming is the physical manifestation of that water balloon pressure overpowering your abdominal wall. If you are doing an exercise or even just sitting up straight out of bed, and you look at your stomach and see a raised ridge or a pointed cone-like bulge pushing out vertically along the midline of your abdomen, you are actively doing damage.
That bulge means the internal pressure is too high for your connective tissue to contain it.
Yeah. If you see doming, you must stop the movement immediately. You roll to your side to get out of bed using your arms. You never just push through it.
So to rebuild that internal strength without causing doming, the 0 to 6 WINT phase focuses entirely on internal support structures.
Correct.
The POGP guidelines recommend targeted pelvic floor exercises, aiming to hold a contraction for 10 seconds to build endurance.
Followed by fast, flicking pulses to build quick reaction strength for when you sneeze or cough.
They also emphasize abdominal bracing, which is gently drawing your belly button inward towards your spine without holding your breath. You are simply waking the deep core muscles up, not loading them.
We also need to highlight the specific mechanical protocol for C-sections here. If you've had major abdominal surgery, you have to actively provide the counterpressure that your compromised muscles currently cannot.
Like physically holding something against it?
Exactly. The guidelines advise physically holding a pillow or a rolled-up towel firmly over your incision when you cough, sneeze, or strain on the toilet.
That counterpressure stops the wound from physically stretching during sudden spikes in abdominal pressure.
It's so crucial.
The medical consensus also strongly recommends that C-section patients wear a supportive Lycra belly binder day and night for the first 4 to 6 weeks.
It provides compression to control the swelling, and it essentially acts as a synthetic external core while your internal biological core is completely offline.
So, once you survive those first 6 to 8 weeks and the wet concrete has finally set enough to handle light loads, you move out of the acute tearing risk phase.
You're entering a new stage.
This brings us to the bridge. How do we get a listener from walking around the block to eventually being capable of heavy gym sessions?
Right. The sports medicine papers call this the body conditioning phase.
And the principle of the conditioning phase is volume before intensity.
Yes. Your body and your nervous system are ready to handle increased muscular work and elevated heart rates, but your pelvic floor is absolutely not ready to absorb high-impact shock waves.
So this is the era of the static bike, the cross trainer, and gentle Pilates.
You are loading the cardiovascular system, but you are keeping your feet planted.
Now, a lot of people are eager to jump into the swimming pool at this low-impact stage. Swimming is phenomenal cardio, but the NHS and HSE guidelines include a strict, non-negotiable biological caveat about what it is safe to enter the water.
This is so important. You must wait until your postnatal bleeding, known as lochia, has completely stopped for at least 7 consecutive days.
7 days completely clear.
Yes. And the exact same rule applies to any vaginal discharge following gynecological surgery.
And the mechanism behind that rule is entirely about infection prevention.
Correct. If you are still experiencing lochia, it means your cervix is still slightly dilated and the internal placental wound inside the uterus is still actively healing and shedding tissue.
So if you get into a public pool, a lake, or even your own bathtub before that internal wound is fully sealed,
you are exposing an open pathway directly to your uterus to external bacteria. You are at a very high risk for a severe uterine or pelvic infection.
Wow, okay. So once that 7-day clear window has passed and you are safely on the static bike or the cross trainer, we can start talking about reintroducing weights.
Light weights.
Right. The guidelines suggest light weights, generally under 10 pounds, but the focus must shift entirely to muscular endurance rather than maximal strength.
You want to aim for high repetitions, usually sets of 15 to 30 reps. If we connect this to the bigger picture, you are basically re-greasing the groove of the movement.
Retraining the body.
Exactly. You are teaching your muscles, you're remodeling collagen, and your nervous system how to communicate and handle a sustained load again without relying on ligaments, which, as we mentioned, are still loose from the relaxant.
I love that. And the sports medicine papers also offer a brilliant biomechanical trick for this transition phase. Here's where it gets really interesting. When a listener does feel ready to start introducing very slight impact, like a brisk power walk or a light jog, doing it on an incline is vastly better for the pelvic floor than doing it on a flat surface.
It sounds completely counterintuitive because walking up a hill or setting a treadmill to an incline feels significantly harder on your lungs and your legs.
Yeah, you'd think flat is easier.
Right. But that incline fundamentally changes the physics of your pelvic mechanics.
Let's break down why that is. Because a lot of new mothers and post-surgical patients develop what is called an anterior pelvic tilt.
It is a leftover postural habit from pregnancy. To counterbalance the weight of a growing baby in the front, the lower back arches heavily, and the front of the pelvis tips downward.
And when your pelvis is tilted forward in that anterior position, your pelvic floor muscles are stretched taut in the wrong direction. They are mechanically disadvantaged.
It's like trying to use a trampoline that has been strung too tight on one side and too loose on the other. It can't bounce back to catch any weight.
Ah, I see. It cannot contract optimally to act as a shock absorber.
Precisely. But when you walk or lightly jog on an incline, the physics of gravity pulling you backward naturally forces you to tuck your pelvis under into a more neutral position.
So it automatically corrects that excessive anterior tilt.
Yes, this places the pelvic floor muscles in a much better biomechanical alignment to catch and support the downward force of your internal organs.
Okay, so we've built the endurance, we've corrected the pelvic tilt. Let's say we are now at the 12-week mark. How does the listener know if they are actually ready to return to running, heavy barbell lifting, or like a CrossFit class without risking a prolapse or chronic incontinence?
The 2026 sports medicine evidence is emphatic about this timeline. Anyone telling you to go for a run at 6 weeks postpartum simply because your incisions look fine is operating on an outdated 1990s medical standard.
A standard that needs to go away.
Definitely. 12 weeks is the absolute non-negotiable minimum timeline for returning to running and high-impact activities.
And if you had a C-section or if your chosen sport involves unpredictable multi-directional impact like CrossFit, rugby, netball, or tennis, that timeline gets pushed out even further to 16 to 20 weeks.
Which can feel like an eternity, but it's necessary.
But the calendar date is just the baseline, right? The 2026 guidelines outline a literal physical checklist you have to pass before you lace up your running shoes. It's called the physical capacity test.
It is effectively a pass-fail mechanical exam for your body. The first step: can you complete 30 minutes of brisk walking completely pain-free? If yes, you move to step 2.
Step 2 requires 10 single-leg squats per side, and you have to execute them without wobbling, without losing your balance, and without your knee caving inward toward your other leg.
Because the biomechanics of running is essentially just a rapid series of single-leg hops. If your glutes and core cannot stabilize your pelvis while standing on one leg during a slow, highly controlled squat,
then your biological structure will absolutely collapse under the dynamic, repetitive load of running.
Exactly. The third step introduces plyometrics. 10 forward bounds jumping forward and landing on both feet, followed by 10 single-leg hops in place per leg.
Wow, okay, so this specific step tests your pelvic floor's ability to handle plyometric downward force.
Yes. When you land a forward bound, the kinetic energy shifts your internal organs downward with gravitational momentum. Your pelvic floor is the trampoline that has to catch that sudden weight.
And finally, the test concludes with 1 minute of jogging on the spot. While a listener is going through this checklist, the medical sources outline clear red flags. What physical sensations mean an automatic fail?
You must stop the test immediately if you experience any of the following: a feeling of heaviness or a dragging sensation in the vagina.
Heaviness.
Yes, that heaviness means the trampoline springs of your pelvic floor are still too loose to catch the organs, which is an early warning sign of pelvic organ prolapse.
That's terrifying. What else?
You also stop if you experience any urinary or fecal leakage whatsoever, any doming or coning of the stomach muscles like we talked about earlier, or any pelvic or lower back pain.
So if any of those red flags occur, your body is communicating clearly that it does not have the structural capacity for high impact yet.
Right. You take 2 to 4 more weeks of low impact capacity building on the bike or cross trainer, and then you try the test again.
Returning to the gym isn't a date circled on a calendar. It's a graded checklist based entirely on physical competency. It's like an MOT for your body.
I like that analogy. And crucially, once you do pass the physical capacity test, you do not just go out and run a 10K.
Right, definitely not.
The medical consensus strongly recommends using a couch to 5K interval method. You run for 1 minute, you walk for 2 minutes, you keep that ratio going for 20 minutes total. From there, you only increase your running volume by a very conservative 2 to 10% per week.
There is also a brilliant biomechanical detail in the sports medicine papers for parents who are returning to running while pushing a stroller. Pushing a heavy stroller completely changes your running posture and your energy expenditure.
Oh, absolutely. People naturally want to push a stroller with one hand so they can swing their other arm to generate momentum.
Right, it feels more natural.
But the research shows that one-handed pushing creates a severe rotational pull across your core, which is highly dangerous for a healing linea alba that is still actively trying to stabilize itself.
So if you use the two-handed method, keeping both hands firmly on the handlebar, it locks your torso into a symmetrical position and best matches your baseline speed and natural stride length.
Keep both hands on the wheel to protect your core.
This brings us to the ultimate takeaway for you listening to this deep dive. You have to respect the biological timeline of tissue healing. Healing is an autonomous cellular process. It is not a test of your willpower.
Pushing too hard in week 3 or week 8 does not make you a tougher athlete. It does not prove your dedication to fitness.
It just causes damage.
Ignoring the timeline simply puts you at a statistically massive risk for long-term pelvic floor dysfunction, prolapse, and chronic joint pain. The no pain, no gain mentality of the gym does not apply to a healing surgical incision or a recovering pelvic floor.
And this raises an incredibly important point about mental health. Exercise should be a tool to relieve your stress, not a source of added anxiety or shame.
If you test your physical capacity at 12 weeks and you fail and your timeline to return to the gym takes longer, maybe it takes 16 months, maybe it takes 6 months to pass the test, that is perfectly normal. It is just biology. Do not let the calendar define your self-worth as an active person.
I want to leave you with a brand new perspective to mull over. We spend so much time in the fitness world talking about trying to bounce back. Bouncing back to a past version of ourselves, to our pre-pregnancy weight or pre-surgery heavy lift numbers.
Right.
But what if we completely abandon that phrase? What if we stopped looking at postnatal or post-surgical gym recovery as a desperate scramble backward in time?
That's a great way to look at it.
Instead, consider viewing this mandatory slow rehabilitation period as a once-in-a-lifetime opportunity. Because you are essentially starting from physical zero, you have the unique chance to meticulously rebuild your biomechanics from scratch. You can fix the muscular imbalances or the poor pelvic tilts that you ignored for years. You can finally learn to engage your deep core muscles properly. You aren't just waiting for the wet concrete to dry. You have the opportunity to upgrade the entire architectural blueprint. If you respect the biology and take the time to build the foundation correctly, the physical structure you end up with isn't just going to be the same as it was before. It has the potential to be functionally stronger, more intentional, and vastly more resilient than it ever was in the first place.